on the endodontic clinic, it's a 1-to-4 ratio, so you're supervising at least a maximum of 4 students. And so I suppose once you've dealt with one, you have to then quickly switch to kind of manage the other one, and then they can all come at once, so you're dealing with multiple things at once. And then there's periods of kind of rest, I suppose, as they're getting on with things. So the pace is it keeps you on your toes and keeps you concentrated. And you know, having the overriding kind of responsibility, I think also keeps you on your toes as well.
Because you're not in control, as in it's not your hands, you know, with that patient. So anything can.
Exactly, it's almost a vicarious responsibility in a way. So you just want to make sure that the students are performing the tasks at the right pace in a safe way. And often we don't like to, or I personally don't like to put that time pressure on them in the first years anyway. It's important that they kind of soak up that learning experience.
One of the feelings I get sometimes talking with newly qualified dentists, maybe even senior dentists as well, is that there's almost an expectation that students should qualify and know everything and not make certain mistakes. What would you say what does dental school achieve for students?
Yeah, it's a really good question. I think I would say at the very least it's designed to really make students a safe practitioner outside of the building. But I think there's a real move now to make them into competent practitioners, and I think there's a difference.
Can you just go a bit into that?
Yeah, I suppose safe you might be considered as kind of the bare minimum is what is required. But I think competent goes a little bit beyond that, where you can fluently maybe perform some procedures or be familiar with what is required to take on new procedures, etc. And so I think there's more of a move, and there may have been some recent guidance out by the GDC on the teaching framework to suggest that things might be moving in that direction. I'd need to refresh myself to confirm that, but I think that's what, at the very least, it's that students should be safe practitioners out there.
So students shouldn't feel overwhelmed when they qualify that I need to know all of this, just as long as they know that they can perform safely on patients and they can continue to learn and be more confident.
I think another thing that students should be leaving dental school being aware of is that there is still learning to be had, and where that learning can be kind of had effectively, where you could go to achieve that learning or self-direct your learning in a way that helps you overcome challenges that you might overcome. You know, the dental school isn't going to teach you to be ready for every challenge, but it can probably teach you to be competent enough to be aware of your own limits first of all, and then also, if you want to be taking on challenges, how to take them on in a safe manner. And there's certain structures in place, such as with your VT and your dental foundation training, that facilitate that effectively.
That's good to hear.